Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and I'm really wanting to stay connected to every one of my listeners in between the bi-weekly podcast episodes. So please follow me on Instagram and Facebook at Brayton Birth Method to stay up to date with inspiration, empowerment, and education regarding the perinatal phase of a woman's life and everything afterwards as a parent. Today's guest is Dr. Jennifer Variste. She's going to be speaking on working mama guilt. Because her visits to her pediatrician were usually positive experiences, Dr. Variste's desire for pediatrics began at a very young age. Later, she fulfilled her dream and obtained her medical degree from the University of Texas Southwestern Medical Center. She went on to complete a pediatric residency at UT Houston Health Science Center. After residency, she returned to practice in her hometown of College Station, Texas. Dr. Variste is grateful for the 5 years she spent treating the families there and for the relationships and connections she made. This winter, Dr. Variste and her husband began their newlywed life as newcomers to the Spring area. As a board-certified pediatrician, her passion is to empower moms and dads to raise their kids to lead healthy, happy lives full of precious memories and discovery. She desires to create the same positive experiences for her patients that she had with her pediatrician as a young child. Dr. Variste is thankful to be a new member of the team at Family First Pediatrics and is excited for the new relationships to be made. For more information about her, please visit her website at familyfirstpediatrics.com. Hello, welcome Dr. Variste to the show. I'm very excited to have you on today.
Hi, Laura. I'm glad to be here.
Yes, so I'm excited that you reached out to me and you were interested in being on Well-Adjusted Mama to share your interest and passion for speaking on working mama guilt. I know that's a big topic for a lot of the women, a lot of the moms in my practice. I certainly see that a lot, and I have experienced it myself as a new working mom. So let's just start off with sharing kind of like your backstory of how you got into this expertise.
Sure. So I'm a pediatrician. I currently practice at Family First Pediatrics. And throughout my experience as a pediatrician, this really became pronounced at the newborn visits and onward. As the baby grew older and the mom was getting ready to go back to work, there was more sentiments about, guilt of having to go back to work and questioning of whether, the mom was a good mom or not, and self-doubt as a parent. And so I often found myself in the position of encouraging the mother and giving her the facts to let her know that she was doing a great job. And it seemed to uplift her and make such a difference that just recently I started doing this outside of the clinic walls. And so I've, done some speaking on this. And I just make an effort to encourage moms and remind them that they are doing a good job.
Mm-hmm. Yeah, I think that's such a good reminder for all of us, especially when we feel like we're not doing enough and a lot of this guilt and shame will come up. And, just recognizing that, we are good enough, right? And we are enough. And, let's just, if you have any, some helpful hints to share about helping, especially new moms that are going back to work, how to manage the overwhelm of their job, their home life, their marriage, all of those components that go into a woman's life.
Sure. I have 3 things that I want to share. The first thing I want to address is this feeling that we don't have enough time to do everything that we need to do. And I actually mentioned this several times at the newborn visits, that moms, don't be afraid to ask for help. Leverage other people's skills and time, because there is not enough time to do absolutely everything. So just do the things that require your skills, and the other things that can be delegated to someone else, don't be afraid and don't feel bad about doing that. The other tip I wanted to give is strive for progress, not perfection, because a good mom is not a perfect mom. And so a perfect mom doesn't exist. So that does not yield any positive result in you or even in your child or parenting. Because if we are always striving for perfection, then we're teaching our child that, nothing else is acceptable. And that's not really the message that we want to share with our child. So strive for progress. If things are better than they were yesterday, then you're doing a great job. The third thing I wanted to share is celebrate the small wins. Sometimes as moms, we get so focused on some things that small things that have worked out, we kind of forget to recognize. And if we make an effort to do that, that is a huge boost in self-esteem. There are other people that may not be able to celebrate those same small wins. And then also sends a message to your child that, it's okay if not everything goes according to plan, but let's take the time to celebrate what did, work out. That's a great message to send to your child.
It really is. And this is once again a good reminder that as parents, we're modeling for our children. So the way we react to our environment is completely, our responses are completely, being modeled for our children to watch. And a lot of it's even nonverbal, right? The nonverbal cues that we do, they just absorb it all. They soak it all up those first 7 years of their development, especially. And, not that it's a pressure to once again be a perfect parent, but recognizing, I think this is one thing that I appreciate with you mentioning that about not being perfect is when we do make mistakes, I really have gotten into a better habit myself of apologizing to my son. Like if I did something that it was not appropriate to him, and he's 2.5 years old, is to let him know this is about being human, and when we do make mistakes, because those are inevitable, how I react to that mistake, I think, is the most important thing to show him.
Absolutely, I completely agree. We're teaching them life skills, and so it's funny because Harvard actually did a study of children of working moms and how they actually grow into very happy, self-confident adults. Because what the working mom has showed the child is that it's possible to, succeed as a mother and work in a career or at a job. And so that just lets you know that those moms did a great job raising those kids because they feel like their mom did a great job. And a lot of this stems from, the internal maternal guilt, but not really based on reality.
Yeah, I appreciate you sharing that study because I think that is, it's always nice to have the science behind it. And, I think culturally, some of this guilt that might be coming up is what we were, at least I can speak for myself, what we were taught as little girls about, if we want to become a mom, it's one or the other, right? I actually vividly remember my dad actually saying that to me when I was younger. He's like, you can either be a great, career person or a great mom, but essentially implying that both weren't achievable at the same time. And so when I did become a mom, it was kind of like, well, I have my career. I love my profession and my practice and my brand, but do I need to step away from that temporarily to raise my son and be a stay-at-home mom? And that was like a really, it was a hard decision, right? To decide what's best for me, what's best for my family. And I think for me, it was really processing the belief system that I was actually raised with. And I'm sure other women can possibly relate to that. Cultural pressures and possibly even how our partners were raised and their belief systems, right? Of what the woman does in the family.
Yeah.
So we're actually shifting that in our generation.
Yes, I agree. I definitely agree with that. And so that's where priorities come in, because even if you're not a working mom, whatever you do, you're going to have to prioritize what is most important to you and what are you going to focus on, because you don't have time to focus on everything. And and so there will be times where what is needed, for the best thing for the family is that the mom maybe steps away from her career for a while. But that's a conversation And you want to come to a point where you are happy with the decision that you've made because of the priorities that you've identified. And so, yes, I do agree that that is shifting. But yeah, partners do play a part. When you're married, you make a decision together with your partner, and you do have to take into account their wishes. But with the shifting generation, yes, people are maybe rethinking what their priorities actually are.
Mm-hmm. And then even there's the financial component, right? So it's not just like, oh, I love my job and I want to continue it. There also could be an actual financial need for both parents to work outside of the house. Or even now we see even more and more women as the breadwinners.
Mm-hmm. Absolutely. Yeah. Like
Yeah.
I am the partner with the higher income of the household. Um, and no, I do not have kids yet. That's the goal for this year. But I'm already starting to feel the guilt as a working wife, like because my husband has wishes, and there are demands that need to be met at in my office. And so, yeah, that is very much a reality.
Yeah. And juggling that all. Yeah. So I'm a big fan of delegating, and I think it is really important. As women, we really sit down, we get really clear about what are things that we really are good at and really enjoy doing, and to your point, are like skill activities that really no one else can do except us. And then what are things that other people can do that we can delegate out and not feel that overwhelm and not feel like you know, like it is like, okay, I don't need to clean my house. I can have somebody else do that and do the laundry and things that I don't really enjoy doing so that I can instead, when I'm not at work, spend time with my son and not be cleaning the house.
Yeah, it's a matter of priorities and what is important to you, and also setting realistic expectations. So, just accepting and, understanding the fact that the house may not look perfect and spick and span every day, but what's more important to you is maybe to spend that time with your child than spend it cleaning the house. And that is okay. You come to terms with that and accept that, and you've exceeded because you've met your goals for the day.
Mm-hmm. That was a hard one for me because certainly pre-child, I always enjoyed having like a neat house, and our house is clean, but there's a difference between clean and neat, right? And now with a toddler, we have toys all over the place. And at the end of the night, after he goes to bed, it's like, do I really want to be on my hands and knees picking everything up? No, not really. I'm like, the nanny's here tomorrow. You know what? Like, who cares? Let's just leave it out. If the cleanup song wasn't as effective as we wanted it to be. And, it's just like, I have to be like, do I really want to do this? Or do I want to like read a book? Or do I want to connect with my husband? What's a better use of my time? And really getting over this, like, who cares if there's toys all over the house right now? No one's coming over. No one else has to see this. And it is kind of like, really, priority is really, I think, important, and being very conscious about what is important and what is a priority. It goes back to time management, right? Like, how do I want to use my time? And what's the best way to use it? And that really gives me joy and fulfillment, right? Yeah. So what about like when you have moms in your practice that are feeling a lot of guilt because they do enjoy their career and they're wanting to climb the corporate ladder, and like, let's say maybe they're having multiple children, so there could be some interruptions with that career climb. Like, what's the best way to manage that?
Yes. So that, also just comes down to priorities and figuring out what is important to you and having a conversation with your partner, because that's a family decision, and now you're married and you want to get your partner's input and come to a conclusion together. So yeah, sometimes in life we're in situations where we have to make tough decisions, and we really have to dig down deep and do some soul searching and figure out what is most important to us. So for those moms that, really enjoy their career, but they are, wrestling with, I don't know, maybe childcare, or maybe there's a child who needs a little extra care, maybe a special needs child or something. It just comes down again to figuring out what your priorities are, and then also what needs need to be met immediately. Like what can be pushed off for later, and what do I need to address now? And that's a conversation that you have with your partner, and y'all come to an agreement together, something that you are both okay with. But yeah, sometimes we just have to make those tough decisions.
Yeah, and I think specifically, excuse me, with the career, progression, I think that sometimes, I know at least for myself, like I'm like, well, I want to be at a certain place in my career by a certain age, right? And then when you have a child, it can feel like you're taking a little bit of a step backwards because there's different priorities at that point. But recognizing, especially when your child is young or children are young, that it is a temporary part of your life. Like they're not going to necessarily have the same amount of needs, and the priorities will change as your child gets older. And so, I've had women in my practice who have stopped, taken themselves out of their career for a bit because their children have had special needs and have required more attention. And they plan on going back, so it's recognizing like this is not for the rest of your life, but maybe you need to take a temporary break from the workplace in order to focus on your family and what your family needs.
Just from my personal experience, I kind of went through that with my husband, because we got married a little over a year ago. And, the plan was, when you're out, we would start having children. But I started a new job and we moved. And so there were a lot of transitions that occurred in a short period of time. And I hadn't felt like I was completely settled and ready. And I also wanted to at least not establish myself at the new office, but at least get settled in and develop some sort of understanding and familiarity with the practice before we started growing our family. And that was just a decision that we talked about. And that was the conclusion that we came to. And so, we're going to wait a little later before we start a family. But at that time, that's what felt like the right decision for us at that time.
Right. Yeah. So sometimes there can be timing, changes that occur. And I think having flexibility around that is important, whether it's a delay in starting a family or a delay in, a promotion at work, either one. It's like recognizing that this doesn't mean it's never happening, but it's just, there's a divine timing component that we have to pay attention to and respect.
Right. Yeah. Yeah. And I've talked to moms in my office about this, and a lot of it just comes to embracing life and embracing moments when you come to these points in life where you have to make a decision one way or the other, and accepting your decision and moving on. Like you've accepted your decision, you've embraced it, and you move on. And so yeah, I've talked to moms a lot about that. Of if this is what you're deciding to do, let me empower you in this path. But there is a lot of guilt.
Mm-hmm. And Jennifer, like what you're talking about is sometimes some really tough decisions. So what about when you and your partner are not in agreement with some of these like really big decisions? Like, do you have any advice about how to reconcile that?
Oh, wow. So I am not a marriage counselor, but that can be very tough. And actually, to be honest, me and my husband had to have several conversations, and they weren't, nice conversations sometimes. And it took a while, before we came to a point of agreement. But if something like if your partner, if there's something really, really important to your partner and it's conflicting with the personal value that you hold, you really have to think about, okay, how important is this to me? Is it important enough to, really challenge, this value that my spouse has? Do we need to have an objective third party involved to help us work this out? Um, but yeah, you just have to really do some soul searching and determine how important is this to me. So for me, it really came down to having a kind of settled home to bring my child into. I did not want to bring my child into like a setting that was very like non-predictable and not yet permanent or settled. That was just really, really important to me. That was a value that I held very deeply. And after several conversations, we, went back and forth. Me and my husband came to an agreement. But yeah, you just really have to do some soul searching.
Right. And so to your point, like there could be some multiple conversations required. And sometimes it means that you do need to like work with like a marriage counselor, like you mentioned, who can give some objectivity and a little bit of a non-emotional component to, what both parties are bringing to the table. And, at the end of the day, especially with these types of conversations where we're talking about family and like a lot of people choose to get married because they want to start a family, right? That could be like one of the main reasons why they're choosing to get married.
Exactly.
And both people of the relationship, both parties of the relationship are coming from their own family upbringing, their own belief systems, right? That could be quite different from the other person. And it's so fascinating to me how, in a relationship like that, how you get to really, there's a lot of growth that can occur because, the other person is really like reflecting back to you your belief systems. And then you're like, okay, do I like this or do I not like this? Is this something I want to hold on to, or is this something that I might need to let go of and release?
And a lot of it comes down to communication and how you're presenting, your proposition, if I may. But for example, so like both of us, both me and my husband value family. That's really important to both of us. And so if I said to him, well, I'm not ready to have a child right now. I want to, get established at this new job first. Initially, it sounds like, I don't care about having a family. I just care about my career. But if we delve deeper and I have more conversations with him where I get a better understanding of what is the value that is, propagating, his goal. And it helps me understand how to better communicate my value to him. So then I was able to share with him, well, the reason why I want to settle down on the job is because I just got it. It's not, I'm in a, trial period and it's not yet established and it's not settled. And I don't want to bring the child into like a situation where things are not yet settled and established. I want to provide security for this child. And that goes back to family values, which we both have. So like having those sometimes it takes more than one conversation to tweak that out, to get deep down to the root of why it is you're wanting what you want, and understanding the root in your spouse as well, and being able to communicate that to each other where you are touching on the value of your spouse as well.
Mm-hmm. Right. And like you said, I think it can be a little confusing sometimes to understand, like if somebody has a different perspective, like where they're coming from and why maybe they feel very strongly in a different direction. Right. And, Yeah, I think it all comes back to our subconscious patterns. Like that first 7 years of our life is so instrumental in shaping who we are and decisions we make as adults. So it's really fascinating to learn that in your partner, and it's certainly going to strengthen you as parents and as a parent team, and it will strengthen your relationship as well.
So, one other thing that I wanted to share is for going back to working moms and how I address that in my clinic. A lot of it is encouragement. And as a pediatrician, what I'm learning is that the medicine is so like inundated with volume right now that a lot of physicians don't necessarily have the time to have like a therapeutic conversation with their patient or parent. And so whenever I take the time to like encourage the mom and tell her that she's doing a great job and I'm so impressed, or maybe compliment her on her outfit, or compliment her on her daughter's outfit and where did she get it, it means such a great deal. Like it's very therapeutic. And I didn't realize that the healthcare field was kind of starving for that. But yeah,
that's bedside manner 101.
Yeah. And so that's why I that's another method that I use to just really encourage moms and increase their self-confidence. If they're not hearing it from anyone else, at least they're hearing it from their pediatrician that they're doing a good job.
Wow. So I think, this is a good point to make, that I think all new moms need encouragement, right? And in women in general, it doesn't just have to be coming from the healthcare practitioners, but as friends, as family members, we can really be kind and uplifting and empowering to these women that are really going through a massive transformation in their life, entering motherhood, and that can shake anyone to their core. So, support can come in a lot of ways. There's the physical support of a friend coming over and cooking a meal, or cleaning the house, or throwing in a load of laundry, giving the mama a break while she's resting. But there's also the emotional support of the encouragement and the compliments and the, like, you got this,
Exactly. And what I've heard in the past, especially like I guess from some mommy blogs, is they'll make a joke about how the pediatrician will like inundate them with questions, and the dad is complimented just for being present at the appointment.
Oh,
so that is not what I want to do. And so
well, that's not empowering.
And so it's like, kudos to the dad for being here, but the mom is doing so much that is not being recognized. And so, yeah, that's why I make an extra effort to recognize all the small little wins.
Mm-hmm. And that's a good life lesson for all of us, is to continue to celebrate those small wins, because that's what life's all about. We don't have to just, struggle from big win to big win, but there can be small little wins every single day that we celebrate.
Absolutely.
I love that. It is funny too. I'm just thinking, like, my husband never goes to the pediatrician appointments. And it's just like, yeah, there can be a lot of our like assumption, like this is what women do. Right. And it can be a lot. It can be definitely a lot of work. Did you have any other last thoughts you wanted to share with the audience today?
Well, so I just want to reiterate the priorities and how I did a survey on social media. I posted in a mom group. Basically, I stated, what is your greatest challenge around parenting? And the top three was, that they feel like they don't have enough time to get everything done. And they feel like they're doing a horrible job. And then the juggling of like family life and work life, career life. And so, yeah, that's just what I want to leave with your audience is don't strive for perfection, strive for progress. If you're doing better than you were yesterday, then you're doing an awesome job. And don't carry the burden all on yourself. Just do the things that you require your skills. And you can use other people's time. They can get some of the other activities done that don't just necessarily require you doing them, and celebrate the small wins. Don't take for granted all the things that are going right in your life and all the things that you're doing well, and that your child adores you. And so that must mean that you're doing something right. And I'm always at Family First Pediatrics in Spring, Texas. If a mom ever feels like they need encouragement, I'm also on Jennifer Variste, MD, at Facebook and Instagram. And the website for our practice is www.familyfirstpediatrics.com.
Wonderful. Jennifer, thanks for that recap and just that reminder of, we can all do this with just this celebrating the small wins. I like that. I really appreciate that.
Great.
So thanks again for coming on the show.
Thank you very much, Laura.